So I'm so happy that the FDA has decided to remove the age criteria for Neffy. We know that patients come in all shapes and sizes, and really that the 1 milligram Neffy epinephrine nasal spray is appropriate for patients who weigh between 33 to 66 pounds. And I think it's nice that now this is really comparable to the other epinephrine delivery devices that we have, where it's all just weight-based, it's not age-based. I think it's really nice to think about that Neffy otherwise would be something where even a toddler could have at daycare, at, school, at home with another caregiver that wasn't maybe the primary caregiver. And I really think that this is the FDA standardizing things for kids. I think kids really are neglected sometimes in terms of specific guidance for them. There maybe we're a little bit overcautious. And I think that this change really supports that it's all just about like giving the appropriate dose for the appropriate sized child. And really age is not a factor there that we need to be considering. Anything that helps parents or caregivers to give children epinephrine when they're having anaphylaxis or a severe allergic reaction, anything that we can do to increase that treatment option is really important. And so I think that now that we can use needle-free epinephrine in the form of Neffy for our pediatric patients, I really do hope that caregivers not only will be more likely to have it on them, but will be more likely to actually use it and administer it for those patients in need. I think that there's a lot of fear around epinephrine because of the auto-injector devices that we've had for a long time. And now really we're just giving parents and caregivers more options to figure out which one they're actually going to use. So for those patients that have Neffy, what we advise them to do is to store it at room temperature. Now, having said that, if it's stored in the blister package that it comes in or in the carrying case that's free from Neffy, it's actually okay for the device itself to have temperature excursions all the way to freezing, as well as all the way up to some very high temperatures. It's been studied up to 122 degrees Fahrenheit. So while we tell schools, daycares, summer camps, et cetera, to store the device at room temperature, it really is okay. If it's frozen, as long as it thaws, the device will still work. Even if the device goes up to a high temperature, if it comes back down to room temperature, really, we're not worried about it having any decrease in potency. And I think that this has been a big concern for I'm in Minnesota. People leave their epinephrine auto-injectors in the car overnight in the middle of winter all the time just by accident. And so really being able to use these devices and feel comfortable that they're still going to work, it really provides a lot of reassurance for parents and for caregivers. So training on Neffy for a toddler really is the same as how we train on Neffy for an older child, an adolescent, an adult. I always tell patients, look, you really want to try not to sniff this medication in. It's a nose spray. It's not a sinus spray. So what I usually ask them to do is just take a deep breath in through their nose, kind of a cleansing breath if they're going to have to take epinephrine for an allergic reaction, and then basically to spray. We do know that in those toddler age patients, though, that it is okay, even if a toddler reflexively sniffs. So what I'm going to try and advise the parents is put the child in the most comfortable position for you to administer the epinephrine. I think for a lot of parents, this will be to have the child maybe seated on their lap or even like lying down. And we know that Neffy can be administered in any position. So it's nice to think that your child could be lying in your lap as you put the device to their nostril and then go ahead and spray. And even if the patient does sniff, that it's not going to affect the actual potency or the delivery of the medication. So I'm pretty assertive when it comes to transitioning patients from the 1 milligram Neffy to the 2 milligram Neffy. I only see kids with food allergies typically once a year. And so I really have to be thoughtful about when I increase their dosage. So even though the package insert says that you should do it at 66 pounds, anywhere between 55 to 66 pounds is when I start talking with families about it. Now we know that Neffy has a 2-year expiration for most patients. And so it's really easy for them to actually be able to have their device for longer if they haven't needed to use it. But I think that anytime a child is approaching that 55 pounds, I will caution the parents, hey, the next time we refill your prescription, we should really be thoughtful about what dose we give them. As far as clinical parameters or specific patient histories, I don't think a lot about that. I really feel that the best guidance is to just go on a really straightforward change of dosage when the patient is at that specific weight. I will typically start increasing patients anytime after 55 pounds, just to make certain that if I don't see them for a year and they have a growth spurt, that I want them to otherwise be covered with the appropriate amount of epinephrine they're getting. So 2 mg would be appropriate. And then anybody that's under, 55 pounds for sure, but above 33 pounds would get the 1 mg strength.